Thank you, Mr. Speaker. House Bill 2925 extends the deadlines for affinity group task forces to complete their work and report their recommendations relating to the allocation of resources to address community needs and health inequities. The Oregon Advocacy Commissions Office must report to the Legislative Assembly on the development of the affinity group task force's recommendations by November 1st, 2023, and report their final recommendations by June 30th, 2026. The measure also extends the deadlines for the Oregon Health Authority to develop and report its recommendations for culturally and linguistically specific intervention programs designed to prevent or intervene in inequitable health conditions and outcomes for individuals who are Black or indigenous, people of color, and members of the 9 federally recognized tribes of Oregon. The first report is due to the Legislative Assembly by June 30th, 2024, and the final report is due by September 15th, 2026. The measure appropriates $690,290 from the general fund to the Oregon Advocacy Commissions Office, which supports the continuation of 3 limited duration positions equivalent to 3.0 FTE in the 2023-25 biennium. The Joint Committee on Ways and Means recommends approval of House Bill 2925 as amended. Mr. Speaker, I would like to add to what the LFO has provided. House Bill 2925 is the continued work from the last 2 sessions, first by declaring racism a public health crisis, and then tasking the Oregon Advocacy Commissions Office and Oregon Health Authority to develop strategies to begin addressing health disparities. When the agencies began to implement House Bill 4052 from last session, they found there were gaps in the process. First, the affinity task forces were set to end this month, with the final report due this upcoming November. The issue here is that OACO only has staff funding through June, with no one to continue the work on the report due 5 months later. Second, the time frame given to OACO to engage with communities who are often hesitant to trust state agencies did not allow time for proper relationship building. Third, the 9 federally recognized tribes were included in the original legislation without proper consultation. Fourth, OHA has only had 16 months to develop a process for mobile health units and get funding out to community organizations to start the pilot program, with only $1.2 million of funding instead of the requested $4 million. Finally, once OACO gives their report to the legislature and other state agencies, there is no follow-through on the recommendations in the original legislation. Even with these challenges, OACO has established the affinity groups and are on track to give a report to the legislature in November. OHA has gotten funding out to 3 of the 17 community organizations who applied to administer the mobile health unit program. House Bill 2925 will ensure that the work that has already been completed will include more feedback from communities across Oregon, and that their recommendations will lead to future legislative proposals and policy change. Mr. Speaker, many communities of color are hesitant to work with state agencies because they have been continuously asked to participate in discussions about their needs, but often there is no implementation of their suggestions. It is time for us to create a space for communities of color, urban and rural, to tell us what their communities need and for us to be responsive and take action. Thank you.